I'm Dr. Robert Richard, and I'm here with Dr. Eric Velasquez. We are the surgeons for the Longstreet Clinic Center for Weight Management, and we're here to answer a few questions that we frequently get from our patients. So why don't we get started?
Is it possible to lose too much weight with surgery?
That's actually a very good question, but it's rare that we'll have a patient that loses too much weight after surgery. With our procedures, and there are multiple types of procedures that we do, the majority of patients will lose between 60 and 80% of their excess weight. So we won't get them all the way to a normal weight. And for someone to lose too much weight, they would actually have to exceed getting to a normal weight and become an unhealthy weight. So usually if a patient gets that kind of weight loss, they've either developed an eating disorder or some of our more aggressive procedures like the duodenal switch, which is a malabsorptive procedure, may have gotten too much malabsorption. And if it's the latter, that patient may need a revisional surgery to prevent that excess weight loss. If it's the former, that patient that has an eating disorder, we really want them to work with our behavioral health team to understand how to properly eat after weight loss surgery. So the short answer to that question is it is a rare person that loses too much weight with these operations, and it is completely abnormal, and it needs to be addressed.
There are some people that we're seeing, the more we do this and the longer the time from surgery, we're seeing some patients that end up gaining weight. So what happens in those cases that the patients already had a weight loss operation, but now they're regaining weight?
Well, that is a tough question, but it is one that we see every day because this disease is a chronic relapsing disease. Just like any other disease, breast cancer, if someone gets a mass removed, if it comes back, that needs to be addressed. This is a similar kind of a condition. If a person who's had weight loss surgery and been successful, and then for some reason they're failing at their weight loss, they're regaining weight, we need to investigate. There are things that we can do to try to get this weight under control, and it's just as important as before that initial operation. So we will evaluate these patients' anatomy depending on what procedure they had, and there may be some surgical options on an individual basis to restore the continuity of that operation and to return that patient to weight loss. So revisional bariatric surgery is real and it is individualized. No two patients are the same, but it is something that we need to address. These comorbidities can come back, the diabetes can return, and with that, the complications associated. So this condition needs to be addressed a second, and for some patients, believe it or not, maybe even a third time. But just like breast cancer, we don't necessarily want to give up on these patients. They need to be seen by specialists like ourselves who can understand their anatomy and help them make some new lifelong changes.
Yeah, it highlights the importance of accepting obesity as a chronic disease. Even though we get it under control with surgery and the weight loss goes away, it can always come back, and that's why it's so important to have that long-term follow-up with the bariatric surgeons.
Some patients say they really don't want to have surgery because they're worried about loose skin. What do you tell patients?
Well, I usually tell them not to worry about it. These surgeries are gonna achieve very high weight loss. It's gonna make the patient healthier. And a lot of times, I'll tell you, probably 95% of the patients that I have operated on in the past 12 years don't seek any cosmetic procedures. There's from that 5%, there's a number of them that are interested in seeking the cosmetic procedures because it was part of the journey to begin with. From the get-go, they had said, I'm gonna have surgery, I'm gonna lose the weight, and part of the journey is that final body transformation. But a lot of people are very happy with the end results. What I recommend is keep a balanced diet, take your vitamins, take your proteins, you can add some collagen, and most likely you're gonna be very happy with the results.
I agree, and I can tell you, I'm pretty upfront with patients. They want to know if they lose it slower, will they have better results? And I say, if you're going to lose 100 pounds, doesn't matter if it's slow or fast, you're going to have some loose skin. But I think it's going to be well worth the journey.
Absolutely.
Another question that I often get is, can I exercise after weight loss surgery?
Exercises is such an important component of weight loss. So you're changing your life when you undergo through this journey, and exercises is gonna become a big portion of your life. So yeah, I'm pro exercises and they should do it.
Absolutely believe in the exercise as a part of this journey, But exercise isn't the only part of this journey. So when I have a patient that is not doing so well and they want to say, well, it's because I haven't exercised, I want them to understand that exercise is a part of it, and eating is a part of it, and lifestyle change is a part of it, and all of this needs to play a role in their long-term success. Well, that's all the questions that we have for today. Thank you guys for tuning in.
Thank you. And if you're watching this on social media, please feel free to comment, share, like us. And if you like this format and you would like more questions to be answered, please send that our way.